So I got my disability claim back again. They said that nephrolithiasis. I don't even know what that means. But they denied me and said I don't have impairment or combination of impairments that medically equals the severity of one or listed impairments. Severity of claimant's disc disease of cervical spine with narrowing of jugular veins does not meet or equal listings. This finding is consistent with state medical and psychological consultants who opine that the claimant's impairments do not meet or equal the severity of any listings. If no acceptable medical source has opined that any of the claimant's impairments meet or equal the severity of any listed impairment. I had 5 doctors write letters to say that due to my cervical problems, I'm 100% disabled. So that's just a lie. There's no evidence that the claimant has required a walker. Bilateral canes, bilateral crutches, or a wheeled and seated mobility device. There's no claimant. There's also no evidence that the claimant was unable to use one or both extremities. Can't really use my left arm, and there's proof of that. It's limited. I guess I can sort of use it, but that wasn't my claim anyway. I wasn't saying like my arms don't work. Okay, so that's wrong. Ultrasound revealed chronic deep blah blah blah. Claimant was assessed with thrombosis. No evidence of complications requiring at least 3 hospitalizations within a 12-month period. That's not true. I've been to the ER 10 times and I've been hospitalized inpatient once. So that's not true. Occurring at least 30 days apart prior to adjudication. That's not true. Never been hospitalized. That's not true. I went to the hospital. I gave them that information. I went to Melbourne Regional because I couldn't get out of bed and I was pissing myself. Claimant's impairment does not meet severity list. Okay. Mental impairment does not meet or medically criteria, blah, blah, blah. So okay, so being suicidally depressed, that's just fine. I mean, if you gave me a gun now, I'd just end my life. Okay, understanding, remember, the claimant has mild limitation. Claimant reports being able to follow written and spoken instructions. Okay. Underwent 2 psychological consultative examinations, neither of which found difficulties in the claimant's ability to understand and remember apply information. Yeah, I mean, I'm not retarded. Congratulations. Immediate memory is adequate. Yeah, I don't have a memory problem. I have the ability to physically do things. Like my brain works. I have depression and connective tissue problems. Friend and family have abandoned him. Pretty much true. Never been fired from a job due to problems getting along with others. Mental status examinations throughout the claimant's treatment are mostly remarkable. I mean, I never claimed that I didn't get along with others. 2 psychological, but I guess they have to check this. Yeah, I don't have problems with my social skills. Mental status, this is all just saying I'm fine. Yeah, mentally fine, which is pretty much like I can do stuff with my brain, you know, like I could do math and stuff. Yeah. Okay. So that's 1 page of bullshit. Notably unremarkable. No significant abnormalities in the claimant's ability to attend and manage his daily activities. I mean, that's not true. Like, I'm in a chair leaning with my head back. If I sit up, I can do that for like maybe a half hour a day. If I could use a computer, you know, I could do stuff, but I can't use the goddamn computer because I get severe vertigo. I'm gonna hold the damn phone. Blah, blah, blah. And I can't afford treatment because it's not covered by insurance. Yeah, regenerative therapy for connective tissue problems. I have Lyme and Bartonella, which isn't mentioned here at all. The thing that's causing all this. Residual functional capacity to perform light work, as defined in blah blah, carry up to 20 pounds, sit for 6 hours. They determined that I could sit for 6 hours. I guess in a reclined position, yeah, I could sit, you know, all day, but like, what can I do? Like, I can't use a computer, right? So tell me a job I can do. And tell me a job that's gonna hire me, because I apply for jobs and they're just like, no, like, I'm not hiring you. Like, you can't do anything. Like, the only jobs I can do are sitting. I can't drive. That's computer work, right? So computer work is what I could do. And I can't use a computer. So, okay. Can't climb. They said I can't climb stuff. Can't operate a motor vehicle. I can't like write on a desk because I can't like lean forward and like write on stuff. So I can't do any desk work. You know? Reasonably expected. Stop working due to physical and mental conditions. Cannot sit or stand for more than 5 minutes without intense pain. It's true. He spends the majority of his day laying down. But they said, you know, I spend the majority of my day laying down in a reclined position. But I also testified a relatively wide range of activities of daily living. No, I didn't. It said that I lived in a house with people who are retired. All I do is I go to the bathroom, I come outside and I sit, and I make myself a few meals a day, and then that's about it. And I could go for a walk every 4 days. Every 4 days I can go for a walk. Yeah, I'm good to go. Prepare meals for myself. Cook meat. He can cook meat in a pan. Ah, God damn it hurts to talk. That's another thing. It hurts to fucking talk. So it's like just if I could just, you know, be like an answering, because I could tell someone how to fix their computer or whatever, but like I can't talk to people. Claimant testified he's unable to look at a computer. Treatment records indicate claimant was sending out so many emails to Dr. Schultz. Dr. Schultz had to have a candid discussion with him, asking to minimize the amount of emails. Why would they mention that? Like, I had questions to Dr. Schultz about the $13,000 procedure, and he got uppity about it. So he can kiss my ass. After careful consideration of the evidence, the undersigned finds that claimant's medically determinable impairments could reasonably be expected to cause the alleged symptoms. However, the claimant's statements concerning the intensity, persistence, and limitation effects of these symptoms are not entirely consistent. That's not true. It is consistent with the medical evidence. That's why I had 5 doctors say that I'm 100% disabled. Medical evidence says I have connective tissue disease, which fucks up my neck, which means I can't do shit. Which of course none of that's mentioned here, even though I provided that to them. Persistent limiting effects of these symptoms are not entirely consistent with medical evidence or evidence record. So no, I mean, the people who are writing this have no medical understanding of anything. Mental examinations, claimant's treatment record notably unremarkable. I mean, you know, suicidal depression. I think I already covered that. Okay, so there's that. Okay, we got 16 pages of this. Claimant's statements about the intensity, persistence, limiting effects of his symptoms that are inconsistent with some medical evidence or records not suggest the claimant is limited as alleged. Claimant alleges a neck injury stemming from moving out of his apartment. Diagnostic imaging of the claimant's cervical spine showed postural changes suggesting muscle spasm. It's not true. But no definitive evidence of osseous or joint pathology. That's not true because my neck's straight. Right? That's bad. Neck straight, bad. Okay, I have to use simple words for these people. C1 rotated, bad. Additionally, digital motion x-ray showed alar ligament damage. I sent them this. That's joint pathology. MRI resonance imaging scan performed on March 23rd revealed moderate central stenosis and it showed narrowing of the right internal jugular vein of unknown clinical significance. It's the cause of my tinnitus. Yeah. Imaging performed on May 12th, 2022 showed damage to the longitudinal... See, I wish I could talk to the people who are evaluating this so that when they're like dealing with this medical issue, of which they have no understanding, I can say, here's what you don't understand. Because I'm talking to my lawyers and they're like, oh, here's this information, guys. And they're like, oh, okay. And it's like, I'm talking to my lawyers. They don't fucking understand. I'm talking to the SSA. Like, the lawyers don't understand what I'm saying. And they're arguing on behalf of my case. They have no idea what the fuck's going on with me. And they're like trying to explain the thing, and they have no idea. Was I consulted? No. Capsular ligament, blah, blah. Wait, so they say I have no joint problems, and then they say imaging showed damage to longitudinal ligament, interspinous ligament, anterior longitudinal ligament, capsular ligament, alar accessory ligaments. Clinical findings are significant for tenderness and cervical spine. Okay, I mean, that's literally the reason why I can't fucking move. Treatments for cervical degenerative diseases limited chiropractic adjustments, physical therapy, and injections. What kind of injections? That's very, very important. It's not required any surgical intervention. That is surgical. It should also be noted that many of the claimant's treatments visits for neck pain were via telehealth. Many of the claimant's treatment visits? No, you can't get treatment for neck pain via telehealth. You consult with a doctor and you say, hey, I'd like treatment, and then you go see him. Physical examinations during routine treatment visits are largely unremarkable. That's not true. I was laying down in Dr. Centeno's or Dr. Schultz's office because I couldn't stand. It was very difficult for me to stand. And so he examined me laying down, as did Dr. Kleinman, as did Dr. Papas. And Dr. Papas said that my ligaments were what you would see in someone who's been in a major car crash. I wouldn't say that's unremarkable because it's nearly killed me. Normal ambulation without the need for assistive device. And, cervical collars and whatnot. So, yeah. The claimant represented the emergency room with complaints of neck. The emergency room, hey. Denied any new injuries. I did not at any point deny any new injuries. The physical examination was normal aside from tenderness in the claimant's cervical spine. That's not true. They did a terrible, well, I guess they fucked up the physical examination. I refused a CT scan on further workup. That's because CT scans don't show cervical ligament damage. Noted the claimant has increases level functioning after posterior injections. This was true. But increased just means that, like, I can walk for, like, a few minutes, Double the amount he was able to walk. Yep, not relying on a neck brace. Not relying on a neck brace if I limit my walking to every 4 days. I was wearing a neck brace yesterday because I had to do stuff and I couldn't physically get up. 90% improvement with the exception of tinnitus. Okay. When someone is functioning at 10% and they improve by 90%, what are they at, kids? It's not 90%. They are at 19%. Right. So, we failed basic math. Okay. Claim of cervical degeneration disc disease. I have no disc disease at all. The undersigned is limited to claim it to a range of light work. It would literally kill me. I'd end up in the ER if I did light work. So that's the third page. Tenderness and cervical spine, blah, blah, blah. Mental functioning. Claim is moderately limited in interacting with others. Inconsistent, blah, blah, blah. It's difficult for me to talk. That's a problem. I'm in a lot of pain right now. I'm going to have to go take a lot of painkillers after this and rest the rest of the day. Consider level review or pervasive. Functional capacity differs slightly. Dr. Stanley's opinion is consistent with the claimant's ability to perform a light range of work. It's not true. No clinical or objective findings to support his limitation. That's not true. I have internal jugular vein compression. I can reduce my symptoms by dietary and lifestyle changes. Ear, nose, and throat, blah, blah, blah. Okay, it's because the ENT is not going to find internal jugular vein compression problems. I don't have hearing, or ear problems. Yep. The opinions of the claimant's chiropractor are unpersuasive. I'm completely disabled. Chiropractor is not a medical doctor or an osteopathic physician, does not specialize in neurology or orthopedics. He's also not an acceptable medical source under our current rules. I mean, that would have been good to tell me at any point. Next, his opinion is not consistent with medical records for his own treatments. I mean, my C1 was very bad. And he proved that. Blah, blah, blah. Says the claimant may prefer a setting with few changes to avoid increased assessment is not supported. This is just psychological examinations again, saying like they're unremarkable. Unremarkable. Says I could do light work. Again, I don't know why it says that again. Full range of the record also documents full range of motion of the neck. Okay, I'm going to show you my full range of motion. Okay. Okay. I've been doing good on the chin tucks. Up is limited. I can't like pull my head back at all. And leaning forward is like really sketchy. I don't want to do that because that hurts a lot. So no, I have about 50% range of motion. Normal motor strength. Normal. I laid in bed for 10 months. How normal do you think my motor strength is? I mean, the amount of atrophy I have is ridiculous. I was down to 142 pounds. The fuck is that? And I was never tested for motor strength. Nobody tested me for motor strength at any time. When I was in Melbourne Regional, they had me walk, and I went about 100 yards. And I mean, that claimant's gait was normal. No. It's not normal. My head bobbles around, and my back's all fucked up. The gait's not normal. Sensation was grossly intact. Sensation. Coordination was normal. I am very coordinated, but nobody tested me for that. 3,000 steps, and no longer reliant on his neck brace. So you said 1,000 steps and 3,000 steps. But yeah, I mean, I could walk for like 15 minutes every 4 days. I could do 3,000 steps, yeah. But like that, then I'm resting for. I can't walk for 4 more days. Like if I walk on a Monday, then next Thursday I can go for a walk. I don't know why I keep mentioning that. Like that's a good thing. Like all it does is support my argument. Like I'm fucked up. I can walk every 4 days. The opinion of audiologist Ann Jenkins is unpersuasive. Ms. Jenkins' opinion regarding claims to noted that only that sleep issues can cause limitations. And that opinion is not supported because Ms. Jenkins marked on the form that the claimant's impairment is not reasonably consistent with the symptoms and functional limitations described in her evaluation. I mean, at the time I saw Ann Jenkins, I was sleeping about 2-3 hours a night. Before the claimant was able to sit and stand, walk for 8 hours out of an 8-hour workday. So, Ann Jenkins, who's an audiologist, said that I can sit and stand 8 hours in an 8-hour workday. And my lawyers said, oh yeah, this is true, and we're going to send this to the judge. And that I have no limitations in doing repetitive reaching, handling, or fingering. Reaching out in front of me is very difficult for me, like doing the dishes, making food, and whatever, which is all jobs you're going to be reaching out in front of you. So none of that's true. This opinion does not articulate how the claimant's sleep issues would cause work-related limitations, not cite any supportive objective findings, and does not cite to any supportive objective findings supporting same. Okay, so this person can't write. This opinion is also inconsistent with the throat specialist with unremarkable findings. There have also been no appreciable findings noted on a CT scan or MRI of the claimant's skull to support etiology for the claimant's reports of tinnitus. I did have an MRI of my skull, which they said earlier found that my internal jugular vein was larger. That was of my skull. They said it in this paper, in this report. They said that I have an MRI that shows my right internal jugular vein is 4 times as large as the left one. That's the skull MRI. That's a head MRI. I mean, the head MRI literally goes to here to here. That's a head MRI. And then they say here, no appreciable findings on a CT scan or MRI of the claimant's skull, this is a skull, to report etiology for the claimant's reports of tinnitus. God damn it. Okay. Oh, it's hard to read. Okay. 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 So yeah, it was 4 times as large because, that causes tinnitus. The claimant also reported being able to control his symptoms with lifestyle changes. No, I didn't say control my symptoms. I said diet and exercise helps. But diet and exercise literally fucking helps everything. I didn't say I'm cured. The undersigned finds the opinion of treating source Dr. Pappas unpersuasive. While Dr. Pappas is an osteopathic physician, his opinion regarding the claimant's ability to sit, stand, and walk and perform manipulative activities is not consistent with the medical evidence of record. It is. And not supportive of his own treatment of the claimant. That's not true. Because he's saw me and saw my history, and he's seen other patients with like a certain level of ligament damage and a certain amount of problems on a digital motion x-ray, and he has a general idea of like if it's this severe, if a patient's this bad, then they tend to be this disabled. So he's got a good idea of like how disabled a person can be, because he sees people all the time that like literally can't stand and walk and sit and stuff like that. Treated the claimant via telehealth and relied largely on the claimant's subjective statements regarding his neck pain as a physical exam, which is not possible. That's not true. I saw him in person. Dr. Pappas has recommended the claimant wean off his neck brace just as an improvement in his cervical symptoms. That's true. Opinion is also inconsistent with our evidence and record. Treating sources Dr. Wateen, Shalhoub. Dr. Wateen was a primary care doctor who did not do anything. No, Dr. Wateen I saw before I got bad. So, like, Dr. Wateen I was seeing before, like, I just had the tinnitus and I didn't know what was going on. It was before my cervical spine got really bad. And same with Shalhoub. Like, I saw her before I even knew I had connective tissue problems and I was able to get around. So they said they consistently know the claimant's gait were within normal limits. So this is before I was bedbound. Does not require any assistive device to ambulate. Just show that right here. This chair's pretty badass. Oh God. Claimant has also exhibited normal ambulation and his consultative examining Dr. Pups also provided no clinical support, like, to support the degree of absenteeism provided in his opinion. I mean, all Dr. Pappas can do is say he has the cervical problems he has, and I say it limits me. I could be lying. I could be making it all up, right? Like, I don't have a broken bone, right? So it's like you can't see that. So, like, if I say I have connective tissue damage, it limits me, then it's like you're just, the opinion. But yeah. So I'm faking it. I got down to 142 pounds and spent 10 months in bed because I was bored. The opinion of psychological consultative examiner Dr. Lornetta B. Williams Sylvester is generally persuasive. I never saw Dr. Lornetta B. Williams Sylvester. Or no, wait, no. Oh, psychological consultative. I've seen so many doctors. Okay. When I get stressed, it gets a lot worse. So, yeah, I saw her, and I only saw her like once. Mental symptoms severe and moderately impacted. I mean, suicidally depressed. So, Gregory Landrum is also persuasive. Claimant's consistent with moderate depressive disorder. I'm not able to find any management. The opinions of Dr. Schultz are unpersuasive. While Dr. Schultz is a treating source, Dr. Schultz's opinions are not consistent with medical evidence record, unsupported by his own notes. Dr. Schultz is the best regenerative doctor. He and Dr. Centeno are the best regenerative doctors in the world. In the whole fucking world. And they see people who are completely disabled literally every week. Every week. They see disabled people more than any other doctor that deals with the spine. Well, maybe not more than neurosurgeons who deal with complex neurosurgery, like maybe Dr. Henderson sees more disabled people. But I'll probably they're like world leading experts on people who are disabled because of neck cervical injuries. So, if Dr. Schultz says someone's disabled, like they're disabled. End of story. Dr. Schultz is a treating source. Dr. Schultz's opinions, one of the best doctors in the world, not consistent with the medical evidence of record, unsupported by his own notes and observations. That's not true. His notes and observations do support his argument. You could disagree with his notes and observations, but they do support his arguments. This is what is written. Dr. Schultz not provide any clinical support. It's not true. Or objective findings support market limitations. It's not true. In claimant's ability to concentrate, severe pain does affect people's ability to concentrate or maintain pace or degree of absenteeism. I mean, I physically can't get out of bed 3 days, except for to go for a walk every 4 days, and, I manage to walk out here, sit in a chair. The claimant underwent 2 psychological, neither which found any difficulties, no suicidal depression. Past work was computer specialty. Okay. I mean, the list is true. The record also documents full range of motion of the neck. Okay, we did that. Yes, no, that's true. I mean, no records indicate I have full range of motion of the neck. None. I mean, I have a digital motion expert where he's like, tuck your chin in my chest, and I'm like, like, I can't fucking do it. Okay, so there's that. That BS. These papers. God damn it. Oh, God. Okay, so you get the idea. Yeah, they're just... these papers. The fucking wind blew them everywhere. So, yeah. I'm fine, guys. The judge says I'm fine. The lawyers who don't understand anything medical said I'm fine. Shit, that they did a shit job. And the judges who don't understand anything medical said I'm fine based on the doctors who diagnose stuff accurately.